Currently in the media, the biggest gripe and complaint about general practice is about the lack of face-to-face appointments and about the ability to actually contact practices. The simple fact is that demand is higher than capacity at the moment, and that demand is high because we're coming out of the pandemic, we're still trying to address the vaccine programme, and we're trying to help out secondary care as well. And that lack of face-to-face appointments isn't down to a lack of desire, it's down to some very simple things. Face-to-face appointments take twice as long or 3 times as long as a phone call or as an online consultation or a video consultation. It doesn't necessarily provide better care, and it's always important that we make it as appropriate as we can for the patients and as safe as we can. This setting here has been open from day one of the pandemic, as have every other general practice settings been open. They've not all been able to actually accommodate footfall of patients, but if your local small branch surgery is closed because they cannot safely arrange for you to go into that building and keep it COVID secure, they will be providing services from another bigger building elsewhere. At no point during the pandemic has general practice closed. It's always been open, it's always been accessible, and it's always been able to actually facilitate patient needs, although that may not always be the same thing as a patient wants. And what we have to do is focus on being as efficient as we can to address those needs in a safe way. So that's what we do. I've been here from day one of the pandemic. Almost every other GP has been there as well, except for those that are extremely clinically vulnerable in their own right. And those GPs have been working remotely from home. Every GP has been working and doing their utmost during the last 15 months to make sure that we give patients what they need. In that respect, we've actually been providing more appointments, particularly since October, and we've been demonstratively nationally providing 1 million more appointments every month. And then from December, we've also been providing the vaccination programme. Anyone can see from the daily figures that the vaccination programme is already up to 60 million plus vaccinations, and 95% of those have been delivered by general practice. That's on top of everything that we do on a day-to-day basis. It's mainly run by volunteers from the clinical side. It's mainly run by people doing it in their own half days off, or in their own evenings off, or their own weekends. So people have been giving up their time. And that brings us to the next issue, in that we cannot have or allow to persist the confrontational elements that are going on between patients and general practice. Our reception staff, our care navigators, they're all trained and they're asked to do what they've been asked to do by the GPs. So that's why they need to know what the problem is, and that's why they cannot just automatically put people into face-to-face appointments. There's a process that we are following to keep people safe and to keep practices safe. And within that process, we need to hear what the problem is so we can decide where best to get you seen. And sometimes that won't be a GP. General practice now has a whole team of individuals, whether it be advanced nurse practitioners, our own nurses, healthcare practitioners, physiotherapists, pharmacists, paramedics. There's a whole group of individuals that are now providing care. And it may well be that you'll get better care than seeing a GP first and being redirected, and you might see people quicker than you would have seen otherwise. So it's important to understand that for those requests that come through, it's not about somebody being awkward, it's not about somebody blocking you, it's not about not giving you what you want, it's about assessing what you need and trying to actually make sure we give you that need and address that need as quickly as we can. Most of our reception staff are on little more than living wage. They are human, they have families of their own, they are patients themselves. It is not reasonable to be shouted at, to be sworn at, to be denigrated and to be insulted. And it's vitally important that we realise that in all of our relationships, in all of our interactions, we should be kind, we should be considerate, and we should consider the feelings and thoughts of the person at the other end of the phone. We're not there to be insulted. We are not there to be shouted at, and we're not there to be abused.